that's a bit of a hard act to follow, although I think some of Tyler's messages I hope to convey to you as well by telling you about something that I never dreamed in a million years I'd be doing when I was at your stage now in medical school. And when I say that I learned more from Dolly Doctor than I ever did in medical school, there is actually some real truth in that. So, for those of you who don't know Dolly magazine, it launched in 1970. It's an Australian teenage girls magazine targeting 13 to 17-year-old girls in Australia, but it also sold in New Zealand. Anyone here from New Zealand? Okay. It then closed in December 2016. And I was lucky enough to be the doctor who wrote the Dolly Doctor answers for 23 years. So Dolly magazine was quite unique. It was the only one of its kind in Australia, so it had the monopoly until 1988 when Girlfriend magazine launched, and then it was really only the two magazines. Dolly always prided itself on selling better and doing better than Girlfriend, although there was quite a bit of give and take over the years, I think. The magazine always had a medical professional answer Dolly Doctor questions. So there was always a Q&A right from the very beginning. And the very first Dolly Doctor was a GP who called himself Dr. James Wright. He did quite a lot of media, print media questions and answers. He wrote for a few magazines and newspapers. He was Dolly Doctor for 20 years and then decided to resign. He then, what happened then was that Dolly contacted a New South Wales-based youth health organisation, and they identified GPs from their membership who would take turns in answering the questions, but they'd each get a bit sick of it after a while. And I just happened to be working alongside one of those GPs back in 1993, and she said to me, "Would you like to take over? I'm a bit sick of doing this. I've been doing this for a year." And I said, "Sure." And I didn't ever really stop until the magazine closed. So one of the questions I'm always asked is, were the questions real? Absolutely. Not once did the editors or the staff of Dolly ever make up a question that was published or that I answered. They also didn't edit them except for typos and grammar, which meant that some of the longer questions never actually got published. Dolly Doctor grew over the years. The section itself got bigger. It had feature articles, and they would often consult with other specialists, other medical professionals and health professionals. They also had intermittent columns answered by psychologists. They once had a sex and your body question, which somebody else answered. But they always had a medical professional. And I happened to be that medical professional for its last 23 years. In the last 3 years, when the sales were plummeting, the magazine was clearly kind of terminally ill, they decided to try a different approach to Dolly Doctor Q&A, and they would invite guest professionals to answer questions. So they would approach people from organisations like Beyond Blue, the Butterfly Foundation. So they'd have health professionals answer those questions as well as me. So they did that for about 2 or 3 years, I think, to see if that might boost interest. Dolly Doctor was always perennially popular, though. It was the one part of the magazine that people still today tell me that that's the first thing that they read. Now, I never had any business interest in Dolly magazine. There were many aspects of the magazine which I didn't approve of. I think it perpetuated abnormal, unhealthy body image. There was very little cultural diversity in the models that it chose it was advertisements that they bought. But they did pay tribute to the fact that it was a reader-generated section in Dolly Doctor, as well as some other sections. They had creative writing and that sort of thing. They had real-life stories, which had nothing to do with health or medicine. So they did respond to what readers were looking for. And so what I found over 23 years was that I learnt far more than I ever thought possible, just from every month systematically answering, researching, and trying to answer questions that readers were asking. So I wanted to do adolescent medicine when I was in about fourth year medicine. It was a new emerging specialty in Australia. It had only been around for about, 3 or 4 years, I think. It's a specialty that still isn't particularly popular. It comes out of paediatrics. So I started paediatric training in the hope of becoming an adolescent medicine specialist. Like we heard from the women this morning who had lots of children, I started having a family very young and found actually that I didn't want to and couldn't maintain paediatric training, which was only ever allowed as a full-time course. So I defaulted into general practice, which allowed me to train part-time. In fact, it was the right decision because it landed me exactly where I wanted to be, which was talking to young people in lots of different ways, including, as it turned out, writing for Dolly magazine. But still today, young people and adolescents are not popular amongst health professionals, particularly doctors. I think we're busy, we have high turnovers of patients, we're usually team leaders in multidisciplinary teams, and we don't necessarily have time to deal with an adolescent who is non-communicative, who might be a bit of a risk taker, and who doesn't want to listen to our excellent medical advice. And we get very impatient and very cross. And I know this not just from anecdote and hearsay. I know this because this is something I've researched as well. So I was a GP. I work clinically with homeless young people in Western Sydney and some of the more deprived suburbs of Sydney. And the rest of my week, I am an academic, and my research has always focused on young people's access to healthcare, the experience of health services, how they navigate the health system. And then the other area of research that I like to do is sexuality and sexual health, including a lot of the stuff that I've done as Dolly Doctor. So what I want to say to you is that young people are amazing. If we actually stop and think about our own adolescence, what it was like for us. Young people are passionate, they're idealistic, they're thinking all the time, their brains suddenly switch on at around the age of about 12, 13, 14, and they don't stop. They're full of energy, they're physically often quite healthy. And if we just spent a little bit of time trying to understand what it's like being a young person, and we learn to communicate with them, it makes us better doctors for all of our patients, whatever area of medicine we specialise in. So what did I learn then from Dolly Doctor over 23 years? Well, first of all, I actually learnt quite a lot of medicine that I was never taught in medical school. My next few slides have a few questions that I'll get you to think about and ask yourself, how would I answer this question? I have 200 words to convey a response that could go out to 500,000 adolescents who read this magazine. So I learnt a lot about how to treat halitosis, hyperhidrosis, the etiology of stretch marks. I learnt about temporomandibular joint pain, tooth whitening. I learnt about orgasm-induced migraine, and plenty more. I found this really excellent evidence-based textbook on minor ailments in primary healthcare. I don't think anything in this textbook was something that I really learnt well in medical school. I also called frequently upon friends and colleagues, dermatologists, gynecologists, endocrinologists, surgeons, plastic surgeons, oral surgeons, dentists, when I needed some of the most up-to-date information that I was going to somehow try and condense into a 200, maybe 250 word answer. I also learnt, from a medical point of view, a lot about physiological vaginal secretions and the various descriptions that young girls used. I learnt about the huge variation in pubertal development for girls as well as boys. We did receive letters from boys, And for a few years, when the magazine was probably at its peak, it had the biggest circulation, it was probably making its most money, the editor actually allowed, at my request, allowed us to publish Q&A from boys as well. They were much harder to find when they had to sift through all the questions, because there weren't that many. But 20% of Dolly's readership was always said to be male, teenage boys. So I thought it was really important that we try and communicate with them as well and answer their concerns. Learnt about periods, tampon troubles, penis size, the problem with unwanted erections, too much hair, too little hair, how to remove hair, pubic hair became a real thing in the last probably 15 years of my tenure as Dolly Doctor. Asymmetry, breast asymmetry, labial asymmetry, the incredibly intense preoccupation that young teenagers have with their changing bodies was reinforced month after month as I answered questions that were similar but different. I never once copied and pasted the same answer. Even though the questions were similar, I treated each one as an individual patient, if you like, or an individual young person. The next thing I learnt from Dolly Doctor was to understand the adolescent mind. What an adolescent is feeling when they write long. A question like this would never have been published. It's too long. But you get the gist. There's so many components to this girl's concerns. We have lots of health messages we can give her. There's lots of health concerns based on what she's written. But there's something else between the lines as well. And I'd ask you, how would you begin to answer her request for help if she was a patient sitting in front of you? Not necessarily conveying all of these words to you directly, because the beauty of Dolly Doctor or Girlfriend or any of those magazines is that they're asked anonymously and they don't actually ask their real doctors. What would you do? What would you say? How would you approach it? I've often been asked what was the most frequently asked question you got as Dolly Doctor, and the answer was, am I normal? I think that actually was the most frequently asked question. So my approach to answering Dolly Doctor questions, no matter how short they were, was always to try and address three issues in the question. Firstly, and I did have medical students help me over the years. I was always keen and willing to invite any medical students I met, and I did teach medical students through Sydney University for many years. If they wanted to, jump on board, write some answers, they were welcome to. And I would say to them, approach this question in three ways. First of all, what are the specific question or questions? What are the facts? What are the medical facts we can pass on to this reader? Secondly, what's the emotion? What do you feel is coming from this reader as she writes this letter in her despair or her anxiety or her privacy or her anonymity? What are you getting? What are you feeling from this question? And thirdly, you are answering the question of only one reader, but your answer is going to be read by up to 500,000 young people. So is there an additional health message you can give to all the readers out there? So for example, I would always, if it was relevant, mention that as a young person, as an adolescent, you have the right to confidential health care. You have the right to confidentiality. You have the right to consent to your own medical treatment, for example, for contraception, if you're underage, as long as the doctor deems you to be competent, a mature minor. I would pass that on, because even if the reader knew that, maybe the 500,000 others didn't know that. I would talk about how to navigate the health system in some way, how to go about making appointments, maybe how to talk to a parent or a teacher about what their health concerns are. A lot of questions were, I don't want my mum to know. Please help me. So I would put to them, well, what if your mum finds out? How would you deal with it? So always a three-pronged approach to any of my answers, if appropriate. And you could almost always find a way to address all those three. Finally, what I learnt from Dolly Doctor was that medicine and indeed school education are extremely narrow in their focus when we teach young people about sex and sexual health and reproductive health. So because I was with the magazine and wrote the answers for so many years, I got to know different editors over that time. I hardly ever went into the office. It was all done by email or fax originally. But I did get the opportunity to go into the office a few times, and they would let me download emails. And back in the old day, before email, they actually mailed me, hundreds of handwritten or typed letters, which I still have in a box at home. If any of you want to do a PhD on an analysis of thousands of Dolly Doctor questions, please get in touch with me. I'm looking for someone who would. There are so many different ways that could be, that those questions could be researched. They're absolute gold. I just haven't had time to look at them all myself. So what I did do was, I published a content analysis on 1,000 emails from 2006. I've currently got another 1,000 sitting, waiting to be analysed, if anyone would like to help me with those. That would probably be definitely one publication, possibly a master's degree. So let me know. The graph on the right was when I did some talkback radio for a couple of years. You will have heard of Kyle and Jackie O. Yeah? So I was on the radio with them back in the day before they got really, really famous and obnoxious. And actually Kyle was a real pleasure to work with. He wanted me to come on the show and answer questions on talkback, and I really enjoyed that time I spent with him. I don't listen to them anymore, and certainly some of the things I hear, which I think a lot of it's media hype. I mean, he's encouraged to behave the way he is. That's what media does. But what these analyses showed was that the things that doctors worry about, STIs, and I haven't got arrows there for contraception, make up a tiny percentage of the sorts of concerns that adolescents and young people have about sexuality and sexual health. Most of it's about relationships, sexual practices, sexual pleasure, how to give pleasure, how to receive pleasure. It's about negotiating sex. So much of what we don't talk to young people about, either in clinical practice or in school. So here are a few examples. I'll go through them really quickly. Have a read, have a bit of a giggle. But here's a sample of questions from Dolly Doctor over the years relating to sexual health and sexuality. Clearly this was sent back in the early 90s, one of the very first ones that I would have received. I really like the juxtaposition with the question and the Winnie the Pooh writing paper. So young people want to know about sexual feelings that they haven't experienced before, and this is true for boys as well as girls. We kind of think, oh, well, once you become horny, it's really cool, and it's not actually. There was a lot of anxiety and distress around feeling these feelings and how to cope with them. What happens with your physiological responses to sexual arousal? Embarrassment, anxiety, distress. It's not all fun and games. A lot of questions about how to be sexually attractive. Boys felt that as well as girls, but of course I had a lot more letters from girls. Sexual function, what we would medically call sexual function. Lots of examples of girls not being able to orgasm and their distress around that, and feeling that it was unfair, which of course it is. We don't teach boys from a young age about the clitoris and about how to make girls orgasm. All we talk about is male orgasm, ejaculation, and how to not get pregnant or catch an STI. Plenty of questions about sexual identity, be it not being sexual, not feeling sexual feelings, having an asexual identity, right through to being same-sex attracted, lesbian, gay, bisexual. So these examples are just a negligible number of the thousands of similar kinds of questions that I read over the years, didn't answer all of them. And I guess the point I want to make there is that most of the content in these questions would never be taught in a school education, sex education program. Is it any wonder then that young people in Australia, when we survey them, say that sex education in school was largely irrelevant? I think if we really want to make a difference, we have to stop being the gatekeepers of knowledge. And that's true for us as doctors or teachers. Young people deserve to know how their bodies work, sexually or otherwise. They deserve to know that having pleasurable experiences with sex is common, and it's why most people actually have sex, old or young. Do you think that answering any of these questions honestly is actually going to lead to an explosion of unfettered, hedonistic, orgy-like behaviour among our young people? Is there any evidence that that would happen? They're going to find out for themselves anyway. Now, what I haven't done is talk to you about a whole lot of other issues that have come up for me over the years, such as gender and power, the double standard, the impact of internet pornography on particularly young girls' genital body image, pressure to have anal sex, the disappearance of pubic hair over the years, trends that I've seen increasing around mental health problems in adolescents. So there's many things that are of concern that have emerged over recent years. However, I think it would be absolutely true to say that what didn't change over 23 years were what I call the perennial perils of puberty. The fact that young people will equate having sex with pleasure and love and intimacy because that is what it is to be human. And that young people deserve to know what their rights are. So I've used a lot of my research in this as advocacy to the Board of Studies, to the National Curriculum on Sex Education, to sex educators, to teachers, and to doctors and health promotion people, because all we ever want to do is talk about STIs and getting pregnant, which we need to do, but that's only a small part of the message. So I'm just going to finish now with one of my favourite questions, which kind of, in a way, sums up a lot of what it was like to be Dolly Doctor for so long. So the point is, whether you work with teenagers, children, the frail elderly, the middle-aged, young adults, whoever you end up working with and for as medical professionals of the future, our role is not to impose our judgment or impose our knowledge in a way that says this is the only way to understand health. Our role is to go on the journey with our patients. It's to help the young adolescent grow up. It's to help them deal with whatever they're dealing with at the time. And just in closing, I want to let you know about a national association called the Australian Association for Adolescent Health. And if you're from New Zealand, there is an equivalent one in New Zealand. If any of you are interested in working with young people, or simply as young people yourselves would like to belong to this association, we are a growing organisation who really want to improve the health and well-being of young people and improve their experiences of the health system and do lots of advocacy for their rights to health and well-being. And we have a conference coming up in November this year, which will include a lot of youth participation and will be lots of fun. So maybe I'll see some of you there. Thank you very much.
Thank you so much, Melissa, for coming all the way to Perth from Sydney. I agree that sexual health is taught incredibly poorly in medical schools, and I can't imagine answering any of those questions. So we've had a few questions from the app, so thank you very much for submitting those. So the first question is, did you ever receive questions that you found concerning, for example, indicating abuse or suicidal intent? Given that questions were anonymous, was there a system for addressing questions that contained this content?
This was a constant concern of mine, and I did actually regularly contact the medical indemnity companies to say, what is my legal liability here? The magazine editors were the middle person, and so I never actually knew the author or the identity of the reader. Neither did the magazine most of the time. So that was one aspect. However, the number of questions that came that actually disclosed abuse or suicidality was extremely negligible. That's not because it doesn't exist, but my theory was that those young people experiencing those kinds of distress went to other forms of help, such as Kids Helpline. And I compared, for example, the analysis that we did with a Kids Helpline analysis, because they've published reports over the years as well that have categorised the kinds of concerns that their customers would email or ring in about. So the answers, there weren't that many actually.
And our final question, what is the most strange or unusual question or submission you received as Dolly Doctor?
There's probably too many to think about. I guess there would occasionally be questions that I absolutely had no idea what the answer was. So it was usually some piece of anatomy that made no anatomical sense, usually to do with some part of the genitals, the external genitals. So, you know, just kind of combination of skin lesions with discharges with strange, you know, physical sensations. So they were probably the ones that I found really weird, and I did sometimes wonder if those might have been made up at the back of a classroom one day, just to test us.
Please join me in thanking Melissa Kang.
Thanks, Jessie. Thank you.